We look all the time for new opportunities. We're looking for some non-opioids. Some of the non-opioids actually make a lot of sense. Most of the drugs, I look at them and I find them rather uninspiring. And I don't mean uninspiring from the point of view of like they don't have utility and don't work in a world where opioids are also available, but I find them uninspiring when I think about the world relying on them and them alone as opioids become harder and harder to get. And that's the world we presently live in. Prescribing is going down, the death rate is going up. We're not doing it right as of right now. We need more clinical sense in what we're doing in our opioid policy. And that's where I hope to land in resuscitating some of these old ideas, rehabilitating them. Many of them, they also got co-opted and became almost cartoons of themselves. But some of those ideas got tied directly to how much opioid a person should have. That's one problem. Some of them also got tied to patient satisfaction scores. I can tell you, as the person in the clinic who often had to tell a patient, listen, we're not going to abandon you, but we are abandoning opioid therapy because you're losing control and it's getting dangerous. And I don't want you to wake up dead one day. And even expressing as much concern as I can muster, because patients would get irate. One of my favorite things to say was, I don't care if you sue me, I don't care if you threaten me, I don't care how irate you get with me, you'll never convince me to do something that I think is harmful to you. And that often took some of the steam out of it, but it didn't help my patient satisfaction ratings, let's put it that way. But what's often forgotten is the beneficence of the opioid movement. People were suffering, and multimodal pain clinics were getting shut down by payers and for other reasons. And so one of the most viable models of treating pain was disappearing. Lots of other drugs existed, lots of other things existed. It's not like pain patients were faring so well. So the beneficence idea is it grew out of hospice. Take pain seriously, communicate about it, ask about it, try your best to apply your skill and do something about it. And if everything doesn't work, don't blame the patient, keep trying, call in an expert. That's what, the idea of that people shouldn't suffer, that's often forgotten now when people just want to tell, sort of stories equating every drug company as, with a drug cartel and want to highlight the evil, they miss the beneficence.